I think the workflow is pretty natural. It's an overlay, so it's basically putting the cursor and then tapping the microphone wherever the screen would be for the end user, for the clinician in this case. So I'd say the learning curve is null to minimum. They're used to this sort of microphone tap experience. Um, but more importantly, the cell's pretty easy when you can start to show data like you're showing on the screen, both reduction in absolute time for total dock time, but also seeing improvements in that last note about completing documentation in the home. And this is really at the heart of home care. Patients, want more attention, and often with EMRs, they feel like they're not getting it because we're looking at a screen and not looking at them. So being able to speak and actually capture that documentation without our hands and putting our hands where they belong is a win-win. So not only are we getting more of it done in the home, and from a quality lens, that's a good thing, but also for all the reasons of efficiency, it's an overall satisfier when folks begin to take that leap of faith and adopt, and then get more proficient over time. Absolutely. I think efficiency just lends itself to many things: better work-life balance, better employee retention, satisfaction, work-life balance. Obviously, faster dock times. There is financial teeth around that. Think authorization, think billing, think accuracy, think NOAs, or notice of admissions for those that are in the Medicare space, or Medicare Advantage space, as you've mentioned. These are all things that have real repercussion. So speeding things up in a high quality sense only contributes to our, I would say, financial viability as an organization in this ever constraining regulatory environment. And as things don't ever decrease, as we know, they generally add on. This is a essential ingredient to both our sustainability now, but also addressing the workforce for the future. They're going to expect it, and we need to be able to provide it to be relevant in the future.